Hey, thank you so much for joining us. Glad you are with us here, part of our growing family of listeners on the HealthCall Live program. It's great to have you on board today. We've talked often on this program about microbiome because it's just a very important factor in all of and how our bodies operate. And, doctors now believe that Alzheimer's, obesity, Parkinson's, inflammatory bowel disease, cardiovascular disease, a number of different conditions are all regulated or at least influenced by what's happening in our gut. Well, now there's a growing level of interest in the microbiome of our skin. So you have two different systems there that are interacting. The microbiome on your skin directly affects your skin health, and so does what's going on in your gut. And we're going to get into all of that and much more today as we meet our guest, Dr. Veerula, medical doctor and also a fellow of the American Academy of Dermatology. She is an integrative dermatologist. Welcome to the program.
Yes, thank you so much for having me.
You will find her here in Fort Wayne at drvskin.com. You are a guest by request. A couple of people asked me to invite you to the program, so I'm glad you came. Thank you very much.
Thank you so much.
So let's talk about this whole big picture of integrative dermatology. How is that different than what we traditionally know as skin docs?
So with the skin, we think that, it's the largest organ in the body. Usually when someone comes in with a condition, we give them a cream, a prescription, and say, okay, take this, use this, and your rash should clear. But now we know, oh, hey, there's so many things that can be going on internally, and starting to look into that and address it, and that will heal the skin as well.
So let's dive into that microbiome on your skin. So you have billions and billions of creatures living on our bodies all the time. So what good are they doing for us?
So we have healthy bacteria on our skin, and they produce different types of anti-inflammatory chemicals or properties that help to heal different things on the skin. And when you have either a disruption of that or a barrier defect, it can cause that microbiome to shift, and then we see that manifest in infections on the skin, like impetigo, or especially with something like eczema or psoriasis.
Yeah. And I read that the bacteria on the skin actually perform an antibacterial function. Isn't that interesting that bacteria are protecting us from other bacteria?
Yes. Yeah, absolutely. So we see that, like, for example, with eczema, that we have staph epidermidis that lives on the skin, and we can see the effects of that, whether that bacteria levels goes up or down, and the chemicals it produces in manifestation with how active someone's eczema is.
So we need to care for that microbiome on the outside of our bodies, and we'll talk about that in just a moment. But then what happens with our skin is also influenced by what's going on in our gut.
Absolutely.
So let's talk about that. What conditions can be related to that, a dysbiosis, as the doctors call it, but something that's out of whack in our intestines?
So one of the big ones is psoriasis. Also, eczema or atopic dermatitis is affected by our gut dysbiosis. Another one that I work on is acne. So we see a lot of acne, variety of ages, from teens to women. And so addressing those barrier or gut dysbiosis, like what's going on at the gut level, is really helpful. And then you have things pertaining to gluten sensitivity or a true gluten allergy that can manifest as well with skin conditions. Really?
I didn't know that gluten was related to skin outbreaks. Tell me more about that.
So you can have a specific allergy like celiac, where you have an autoimmune effect that's targeting your intestine. So you can have that affecting the skin. It's called dermatitis herpetiformis, and you literally form blisters and itchy rashes on elbows and knees, and it's a true allergy. Now, that's different from a gluten sensitivity, where it's dependent on the amount of gluten that you consume, and the symptoms that you can get on the skin are not as correlated. And so that can play a role for certain conditions like psoriasis. But it's definitely taken on a case-by-case individual basis.
So you're going to work to clear up skin problems by helping me adjust my diet?
Absolutely.
So talk about what foods might be associated with what problems.
So I take it more as a generality. So a few different, unless we're on an individual patient by patient basis, but typically dairy can be very pro-inflammatory for the skin. So trying to cut back on any dairy is one of the biggest things I talk about with my patients. And for that reason, starting a probiotic can be helpful to start to balance any effects that dairy, stress, different things have on our gut. And at the same time, as well, trying to cut back on any processed sugars or processed foods is very helpful. Making sure you're eating well balanced, trying to cut back on gluten if that's an allergy or sensitivity for you is also helpful as well.
And how soon am I going to see a result? If I kick dairy out the door, how soon am I going to notice that?
So usually it takes about 3 to 4 weeks, but it can take up to 6 to 8 weeks to start to see improvement. But usually I see my patients back pretty soon, and within a month, there is an improvement, especially if they're a big dairy consumer.
Mm-hmm. Kids and acne, teenagers and acne just go together. It's going to happen, right? Mm-hmm. And that's not a condition associated with cleanliness in any way, usually associated with hormone change and what's happening with the sebum, the oils, and things on your skin. So how does diet affect that?
So, yes, different foods can cause you to produce more oil on the skin, on your skin. So anything that's going to affect your hormones will also play a role. So for some people, sugar, dairy can do that as well with the hormones that are in dairy, making that pro-androgenic, where you're producing a lot more of the hormones that are going to trigger acne, and even just affect things like dandruff, which is seborrheic dermatitis. And that's triggered by a yeast that lives on our skin. And in some people, that yeast just overgrows. It's a Pityrosporum yeast. And so trying to cut back on dairy and different things like that can affect the amount of yeast, that lives on our skin as well.
So are there any guidelines that you can apply just generally to everyone about diet and healthy skin?
Yes. So I would say if you can, try to cut back on dairy. And if you do choose dairy, try to make sure it's organic, because that does play a role. I think trying to cut back on processed sugars is helpful, or processed food in general, making sure to eat a lot of good omega rich foods, so whether that you're getting that from walnuts, flax, chia, that's helpful, or taking an omega supplement as well. There are some supplements that can be anti-inflammatory, and so we use that. So things like curcumin is helpful, vitamin D, zinc, vitamin C. So those are all things that are helpful, and just making sure that you're eating a well-balanced meal, and making sure that's a good approach to a first good place to start.
As we headed into the break, I mentioned that many people are bathing incorrectly, and that's damaging the microbiome on our skin and creating some other issues as well. So what are we doing wrong?
So a lot of us, we think, we need to put soap everywhere. We got to cover every inch of our body. But really, if you think about it, soap it's really a detergent. So it's really stripping oils. It's affecting, the barrier of the skin, and it can dry you out. And there's different things in soap that can irritate your skin as well. So really, I usually recommend just apply soap to the visibly soiled areas, and of course your armpits, the groin area. Try to avoid a loofah or sponge, because those can harbor bacteria.
Wait a minute. That so many people think that that's important, that exfoliation. You're telling us it's not?
No, if I ask and I say pitch it, or if I say just use either the liquid soap with your hands or a bar soap. If you like exfoliation, use like coffee. The coffee grinds are great, or sugar. Make a little, do-it-yourself type product at home, or you can pick one up at the store, and avoid, just avoid the loofah sponge.
How about that? And when I pick a soap, which is actually not soap in most cases, soap is really detergent. Soap is more expensive to make, and it has some other issues around it. So what we call soap is most often a detergent. And when I pick that, do I need to pay attention to pH and alkaline levels? And what do I read on the label that's going to give a product that will help me out?
So usually we want something that does not have fragrances added to it. A lot of people can be sensitive to fragrances. You want something that says that it's for sensitive skin or gentle. And usually you could, a lot of soaps don't put a pH on it, but usually if you pick one that's either very gentle or even an organic or natural one is a better way to go, or one that's homemade is also a good option. Another one that I really like, especially as we go into the winter months, is like a cleansing oil. So that's usually something that I recommend to my patients. So an oil is going to hydrate the skin, but it's filled with a little bit of soap as well, but it doesn't feel like a soap where you're dry after you use it.
Is there a moisturizer that you recommend? Are they different substantially? Some of them are crazy expensive.
Some of them can be.
And others are just kind of grocery store shelf. What's the right product?
So there's a variety of different options. A lot of people also like to use oils or creams. So usually I favor that a cream or an oil is going to be more hydrating. A common myth that I see a lot is that a lot of people love to use, I like coconut oil, but a lot of people love to use it on the skin. And I don't love it plain just because it's not as hydrating. It doesn't absorb into the skin as well. And for some people, it can be comedogenic or clog the pores or cause acne. So I say try to choose one that's a thicker cream. Aven's a great product that I like. If you prefer oils, then I love vitamin E oil. Argan oil is great. Jojoba oil as well. For some people, sunflower seed oil or avocado are other great options.
And you mentioned a product name there. Let's just repeat that so folks can get that.
So Aven, Avene. They use thermal spring water, and they make it out of France. And that one is very hydrating and calming on the skin. There's other ones that they have that have some zinc or copper in it that's also healing on the skin. But I say you don't have to go very fancy. There's different ones that you can get, or even just a very thick or hydrating cream that's not doesn't have a lot of fragrance or scents in it.
Okay. Heather Starr, our producer, is checking in with a text question.
Yes.
Heather, what came in?
Okay. They say, I don't know if anyone will receive this, but they may call in. Everything you are saying is absolutely true, as evidence in our family's life. My daughter had severe eczema, and through removal of dairy and gluten, building the gut, and using methyl B vitamins, it's been nothing but miraculous healing.
Yes, that's amazing, and I'm so glad that you're able to do that in-depth research with your family and see direct changes. So that's true. Like immediately, for if it's playing a role for you, like gluten or dairy, removing those, you'll see a dramatic impact. At the same time, a lot of us have vitamin deficiencies, so that's something that we often check for. So vitamin D, B12, and making sure that we're getting the proper nutrients, whether it's through foods or with supplementation, is very helpful and key to heal the skin.
That person mentioned methyl B. Is that something specific? I don't know what that is.
So a methyl B, I'm not sure if it's a B12 or just a B complex, but that's a specific form of methylated vitamin. So it's the form that's rapidly absorbed and used in the body. So when we take like a B complex, it's converted to the methylated form.
I see.
And you can, for some people, they have a problem with converting that with an enzyme, genetic enzyme deficiency. So taking that supplement in the methylated form can be very helpful for absorption.
We have talked a lot about skin and skin health and skin care, but in your practice you do many other things. And one that I think is of great interest is surgery-free face lifts. Now, spoken as a guy who's starting to get the saggy jowls here, is it really going to address that kind of a problem?
It definitely can. So first thing I say is, there's no alternative to surgery. So with surgery, that's the gold standard. You're going to get the best results with that. I understand if you don't want to go through that. So as a non-surgical option, are thread lifts. So what we do is we use suture that we put an insert into the skin, and when we do it, it pulls the skin up and has an immediate lifting effect on the skin. At the same time, the suture that we use is a collagen stimulator. So that suture is going to dissolve over 3 months, but as it does that, it's going to really stimulate your collagen and help with texture and elasticity. So you get a twofold effect with those.
I think I need to know a little more about that. So you're going to suture beneath the surface, I assume?
So correct. So we make tiny insertions into the skin. So if I was going to lift my skin like this, I would make a couple insertions. I insert one thread parallel threads into the skin. So let's say I'm going to insert one going here, one going here, one going here.
And on the radio, she is striking down her jawline sort of across the cheekbone and striking down toward the mouth. Okay.
Correct. And so those threads we then pull up, and as it pulls up, it cinches the skin and pulls the skin up, and that has an instant lifting effect. And then at the same time, the threads will stimulate your collagen. So it's a great alternative.
So you're mechanically lifting the skin.
Correct.
But doing it from the inside out.
Correct. So the sutures have little cones that adhere when you insert them. It latches into the skin, and then you pull it up so the suture isn't moving, and it's very specific than a suture we use in surgery. So they're very specific and formulated for a thread lift.
What areas of the face respond to that treatment?
So the cheeks do really well, but you can do neck. You can do the neck. You can do, for some people, the forehead or under eyes, but the cheeks are the most commonly performed areas. What
type of downtime am I going to have? Is it going to be real obvious I've had this procedure with bruising and other things?
For some people, it can be obvious. So others, not so much. So it's something that can take 2 to 4 weeks to fully start to settle down. And it all depends on the texture and your skin before we start. And that's usually something that I sit down and go through with you in a consult.
And how long is the effect's going to be obvious, and how long will it last?
So usually, I would say bruising, swelling, that will go down within the first few hours. Bruising can last for a few days, sometimes up to a week. The effects will last about 12 to 18 months or longer. So yeah, it's a great alternative for surgery and something that is newer.
And then I could have it done again, I suppose, if after the effects are okay. Mm-hmm. Excellent. So I've just got a little bit of time left here, but what other areas of your practice are unique and you think people need to know about?
So I think when we talk about other, aesthetic or cosmetic treatments, there's things that other than we do peels or microdermabrasion, but there's different types of resurfacing lasers that are really great and really helpful to stimulate your collagen. I love it with the addition of platelet-rich plasma, which is 100% natural. It's from you. And so that's something that we know a lot of the healing properties of PRP. And so using that for something like hair loss or injecting it into the skin as an alternative to something like a filler is also helpful, or using it to stimulate the wound healing response after microneedling is amazing. So
as a filler, PRP, let's talk about that for just a second. What are you doing? So you're going to take some of my, is it marrow?
No, so it's just a simple blood draw that we do in the office, just how you go get blood drawn for a lab. So we take a blood draw and we spin it out in the centrifuge. It separates all of the red blood cells, white blood cells, and at the top, that gold yellow color is the plasma. And that plasma is something that we then use in a variety of different ways, whether we're using it for hair loss, we inject it in the scalp in that case, or if we're going to use it as an alternative to filler, we're going to inject it into the skin, similarly to how we would use a filler to inject into the skin.
And so does that initiate tissue growth in my body?
Yeah, so it's a biostimulator, so it stimulates your collagen. It's going to help with any fine lines, wrinkles. Topically, when it's applied, it's going to help with brown spots and pigmentation as well. And when we use it for hair loss, it's going to help trigger new hair growth and help calm down inflammation in the scalp. And
we have run out of time. I've really enjoyed chatting with you this morning. Thanks very much.
Yes, thank you for having me. It was wonderful.
So that's Vindy Veerula. She's a medical doctor, an integrated dermatologist, and you can find more about her online at drvskin.com.